My name is Dr. James Briles. I'm a board-certified family physician. Been in practice for somewhere over 20 years now. About a year ago, I was involved in care of a very ill gentleman who required a lot of time in the hospital and rehabilitation centers. During this patient's illness, his wife, Mrs. Nancy Hart, was extensively involved in his daily care. And it was through this experience that she came up with the idea and actually saw a great need for an improved patient hospital garment. And therefore she developed her catch-alls line of patient garments. These garments are designed to allow ease of access for the staff and caregivers, as well as for the physicians. This increases patient comfort, reduces emotion and needs, also potential for reduction of infectious transmission. It's also designed for ease of use with IVs and monitors. It can be used in X-ray procedures, MRI, CAT scans, without the need for removal of the garment. There are no metal parts. But one of the main things that I found to be so great for is maintenance of patient dignity, which I find is lacking with the old wraparound tie-up hospital gowns. It also is designed to reduce or even possibly eliminate the need for laundering, so there's no expense involved there. And lastly, they are actually quite stylish. And I think that you'll find that these are very attractive for use in your facilities, for use and use of your patient care, as you will see when Ms. Hart demonstrates the garment in her video. Thank you.
My name is Harold Tabahi. I'm a cardiac surgeon. I've been practicing for over 23 years, both in Florida and Philadelphia, and Michigan actually. I endorse what Dr. Briles just explained regarding this new garment for the patients who are very ill, either in the ICU or CCU or cardiovascular recovery area. I've been very impressed with the design of this new garment, and as Dr. Briles explained, it helps not only with the patients, the ease of access, ease of use. It takes basically no effort to use it on any patient size, small or large. Also, as far as covering the patient for all types of accessibility and tests, it's extremely important for patients' dignity. I really don't have much to say other than since I have seen this design, it seems that it has been one of the easiest and the best design in the market with respect to the use for very ill patients. And again, as Dr. Briles stated, it's very stylish. It's not similar to usual monotonous colors of the hospital gowns, and I think it's very much to patients' liking, whether they're in an ill condition or in semi-recovery condition. It can be used in all patients.
Well, if you've ever had to take care of anyone at home, you know that one of the simplest things to do, getting them dressed, it becomes one of the most hard things to do because of their immobility. Well, Nancy Hart, who has been a caretaker, a patient, and that turned her into an inventor, is here to show us some easy ways of getting people dressed. Thanks for being here. So tell us a little background about the story.
Well, it started 6 years ago when my husband went in the hospital for cardiac surgery and carotid artery, and I watched him being exposed.
Mm-hmm.
I mean, basically, that's what you are.
Yeah.
And I figured there had to be a different way to give people back their dignity.
Right.
And at the same time, help with the medical part. So I came up with patient scrubs.
Okay.
And the good thing about them is they're put together with plastic snaps. So you can take any kind of medical test.
Where do you want to demo this? Here.
Yeah.
Like that.
Right.
And it's just the small ones. And the reason this is an advantage over Velcro is because you don't think about the lines that are being run out and all the different probes.
And it also has a pocket for your heart monitor and a slit for the telemetry to come through. And this last year I went through breast cancer and found a whole new market for them.
Okay.
Because you have people that have ports in their chest, and all they have to do is undo this,
Okay.
and they don't have to be exposed.
I used to have a pair of pants like this, but that was a different
Well,
job.
actually, they're shorts.
Oh, okay. I see.
And and these are for basically it's to give people back their dignity, but
Okay.
it's also for if people that are bedridden that have to have a liner.
Right.
This totally comes unsnapped in the
Okay,
front on
all
both
the way down.
sides and lays flat.
So all you have to do is just roll them a little bit.
You roll them on their side, and you
And
can then roll
you
them
can-
back.
Yeah. Because I
And-
know we took care of my mother, and that was just an extremely difficult thing. Just
Yeah, it
to
is,
try and
and
take care of them
it's
that way.
hard. You have a lot of older people at home taking care of their spouses, and trying to lift somebody is really hard.
And tell us about our model here.
Oh, that's Brittany, and she's modeling our long pants. That they're
Okay.
coming out soon.
Okay.
And we also have a children's line.
Great. Well, give us the model
Yeah.
spin there. There you go. And
The
all
long pants do the same thing that the shorts do.
the whole snap thing.
Right, so that if you have a broken leg, or for catheters, just anything, go right
Okay.
to the.
And this is the kids line. And
Yeah,
tell
that's
us the
the
story
children's
about the little emblem on the bottom.
All right, that's our little duck, and it's called, the children's line is called Catch-Alls.
Okay.
And when my husband went in the hospital, his daughter gave him a little duck like that, and that became the trademark. He carried it for 8 months.
Okay. I would say that this is something not only patients would wear, but probably people in the medical field as well.
Oh, yes.
And we've got a website for folks to go to.
PatientScrubs.com.
All right. And get this new thing. And I'd say you'll find people walking around,
Sleeping in them,
yeah,
they're great to
sleeping,
sleep
walking
in.
around. This is going to be the new sweatpant.
Yeah.
Relaxing clothes. What a great invention. God bless
Thank you.
Thanks.
Thank you.
Thanks.